Pat, this person says, if I've already signed up with an HMO plan back in September, but I want to change to another plan before the December 7th deadline, am I allowed to switch again?
Yes, she is. She has an HMO, which is a type of Medicare Advantage plan. And keep in mind that Medicare Advantage has its own unique open enrollment period, which runs every year, January 1st to March 31st. So folks that have Medicare Part C or Medicare Advantage plans can review their plans during the first 3 months of each calendar year and select plans that may be better for them. And that includes the plans that have, drug plans built into them. So yes, she'll be able to change that HMO if she
Great.
chooses to do so.
Great. This next question is, I'm recently back to North Carolina after living and working out of state. I'm unemployed and staying with family. Do I qualify for Medicare? Steve?
Well, you would qualify for Medicare if you're age 65. You could also qualify for Medicare if you are determined to be disabled by the Social Security Administration. And that would probably be the only couple of times that you would be able to qualify for Medicare. So other than that, you would probably need to hunt a regular health insurance plan.
All right, Laura, someone's asking about the premiums and if the premiums are going up again this year, or what do you say when it comes to, I'm not sure if I can afford ACA enrollment?
Well, if you haven't been able to afford it in the past because of the federal changes, you should absolutely go back to healthcare.gov and look again. And also, when you apply, you will estimate your income for next year. You may be eligible for additional subsidies. So check it out. Difficult to say without looking at their individual circumstances what they qualify for.
Okay. This next question is, I'm going to be 65 in June. My husband is younger than I am, and I'm covered under his medical insurance. Do I have to enroll in Medicare insurance? Pat?
That's a good question. And the answer is no, she doesn't have to enroll because she'll stay covered under the employer plan that her husband is covered with. And as long as that plan is credible coverage by definition that Medicare uses, and most employer health plans do satisfy that definition. So she would remain covered, keep the coverage under the employer health plan. I would encourage her to enroll in Medicare Part A, get that part out of the way as soon as she can, because that's premium free for most folks anyway. But she'll keep her health coverage under the employer plan, as well as her drug coverage.
Right, and there's like a little caveat to that. You have to check the box that says I'm deferring Part B. You don't want to leave it blank, because if you leave it blank, it means that you haven't signed up for anything, you haven't deferred, and then you get charged with the penalty. Hey, Steve, this question is for you. It says, will it cost me to work with an agent?
No.
Explain how that works, because I think some people think to themselves, the agent, of course, is going to charge me.
Okay, well, agents are sales agents. So basically, they're going to help people. They're going to give them quotes. They're going to give them recommendations. If you choose to go with that agent, the insurance company pays that agent, not the customer. And if you choose not to go with that agent, he just helped you for free out of the goodness of his heart. So there you go.
Okay, very quickly, Pat, if you have Medicare, can you also be eligible for Medicaid at 65? Can you have dual enrollment with both of those things?
That's correct. Depending on the state, your state of residence, that type of thing, and whether or not you're eligible. But there is a category referred to as dual eligible Medicare beneficiaries. And in that case, Medicare is primary and the state Medicaid plan would be secondary.
Gotcha. Okay. All right. All three of you, the deadlines are looming. We appreciate your time and your expertise. And if you have any other questions, all three of these folks have their resources that will be in the 2 Wants to Know section, so you can click on those resources for them. Again, in the 2 Wants to Know section.